I was born in Argentina, South America.
Brooklyn, New York.
In Zimbabwe, in Africa.
Flushing, home of the New York Mets.
The island of Jamaica.
Como.
Kathmandu. Atlanta, Georgia.
Puerto Rico. About 4 hours north of New York City.
On a kibbutz.
Near the Appalachian foothills.
In Nairobi, Kenya.
Traditional working class family.
Middle class.
I grew up in a trailer.
We probably could have qualified for food stamps.
My mother was a perpetual student. My dad was a maintenance guy.
They did all they could to make sure that I go to school.
I've always had a dream of becoming a doctor.
I initially wanted to be an astronaut.
Professional baseball player.
I wanted to be a cowboy.
My entry point was Peace Corps.
I worked in clinics all the way through undergrad.
I was a Mormon missionary. I lived in Santiago, Chile.
It was in the Gambia when I was in the Peace Corps that I got my interest in public health.
I worked for an NGO in Guatemala, and I also worked in homeless education in the North Texas area.
I was working as a clinical psychologist with people living with HIV and AIDS.
I was in investment banking, believe it or not, before I became involved in public health.
And I actually worked for IBM in New York doing computer programming.
I have a bachelor's degree in French.
Film and music. Nothing related to health.
I was helping U.S. franchises expand internationally. And I started feeling after a couple of years of working in this that I wasn't getting much out of it.
Ethiopia, Zambia, Alabama, Wisconsin, California,
Bangladesh, Indonesia, Japan,
Paraguay, Uruguay, Brazil,
Scotland, Thailand,
Kenya, Uganda.
All the Southern African countries.
Venezuela, Colombia, Peru,
Kazakhstan, Kyrgyzstan, Tajikistan, Turkmenistan,
Uzbekistan,
Guatemala, Honduras,
Senegal, Togo, Nigeria.
Well, probably half the states in the United States as well. Public health is broader than the medical side of it.
We are also talking of quality products that are being moved within the systems.
You have to really figure out who the clients are.
And the client isn't the government. The client is the mom and child who need immunization and they need a safe food program for their kids.
A community that doesn't have a clinic for people who are uninsured and low income.
It's about building people's capacity, helping them monitor and evaluate the work that they do.
At the end of the day, we're not going to be able to have a health impact if we don't get the products to the people who need them.
What separates JSI out from the others, there's a couple things. We do work in the US and we do work internationally.
There are a core set of things that we do across those, whether it's tobacco or substance abuse or infertility or STDs.
We use the effectiveness of the business world to implement these practices.
The idea there is to try and create as sustainable a model as possible.
We give people skills so that at least they can save themselves. That's the key point here.
I've always felt that the focus of public health is too much on, we're doing the right thing. It's just the good thing, as opposed to being able to say, we did something that actually had a significant impact on that population, and I can quantify it, and I can show you that it worked, and we should do it again.
Everyone in the building is in the business to improve lives.
Last year we shipped over 1 billion condoms. So that's a lot. That's a lot of couples having safe, protected sex.
I feel like I have an obligation, a duty to try and reach out to others and help improve their situations.
It's the people. It comes down to the people.
At JSI, I can really make a difference at a much larger scale. And it really, really fulfills me. And I love it.